And welcome, everybody. Welcome to the Clear Vision Wednesday show. I am Claudia Mühlenweg. This is the first show of 2024, the brand new year. And I'm so excited for this episode. So before I introduce my guest, make sure you subscribe to the channel. You like the video. If you're interested in natural vision improvement, then this is a great channel to follow, because every week I either teach myself or I have great guests on, and we educate you on how to improve your eyesight naturally. So today I have a wonderful guest, Dr. Tanya Paynter. How do you say your name? Let me actually bring you on.
Painter. Like a person who paints, but with a Y.
Painter. So I'm so excited about this topic because migraines and headaches have plagued me for decades, like severely, like not, to the point where I would basically have to take some kind of painkillers when I was younger, like almost twice a week or something. So Dr. Tanya, tell us a little bit about your own background, how you got into what you're doing. That versus me reading a bio.
Yeah. So I wanted to become a doctor ever since I was in second grade. I remember learning about the human body. And so I went to, did my undergrad at UW, went to medical school, but I became a naturopathic doctor, which really helps people to understand how the body works, right? It's not just about giving medications to treat something. It's about figuring out what is causing that problem in the first place. And so when I was 16, I was rear-ended in a car accident, and I started developing pretty frequent headaches that turned into daily headaches that then turned into migraines. And I went undiagnosed with my migraines. Like, I self-diagnosed almost a decade later when I was in med school. So I didn't even know I had it. They were just super severe. The nausea and all the other stuff. And so one of my main goals through medical school was learning how to get rid of them because they were debilitating. And it took me a while to figure it out, but I did. And then when I graduated and started seeing patients in clinic, I really, they were my favorite people to treat because I knew exactly what to do and what steps to take them through. And it's not a one size fits all, right? That's the problem with conventional approaches to migraines. You can't just tell everybody to do the same thing. It's very individualized. So that led me to kind of do this specialty where I help women with chronic migraine exclusively, and I absolutely love it.
So we have so much to cover today, but first of all, I'm curious, what have you found are the most common, you mentioned a car accident, so probably concussion, maybe traumatic brain injury. I was rear-ended too, but that was later, and I had headaches way before then. For me, later on, I realized it was a lot of times like I hold a lot of tension in my jaw, which I didn't realize back then because it just felt normal. Like I didn't realize the jaw was so tight. Probably bad breathing. And then in my 20s, I worked in advertising, too much drinking. We smoked cigarettes. We did all not as bad as Mad Men, the show, but it was, we didn't exactly live healthy, late nights and all that kind of stuff. But what have you found as common reasons that people actually get headaches that didn't have headaches before? Like, what is the kind of some of the causes?
Yeah, so we're finding more and more of those that are linked to chronic migraine. One of the very first things that comes to mind is hormones. A lot of women, they have their migraines start when their hormones start shifting, even in childhood. And nobody thinks about a kid who's, 7, 8, 9 having hormonal shifts, but it happens. And very commonly it happens then, or it happens right around them starting their menses. So that's a huge one for a lot of people that just is not really addressed. And then, obviously stress is huge. Diet is another really big one. We have not great dietary habits in the US. And so when we're eating those, high sugar, highly processed foods, and we're not getting the nutrition that our bodies need, our blood sugar becomes imbalanced. And then that affects all kinds of things, including our neurotransmitter production. So those are probably three biggies: is the hormones, the stress, and the diet, that we have to address first. And then there's all the other things.
That's so interesting because I started working on my own blood sugar like 5 years ago, and I wasn't this good for Christmas this time, but the funny thing is, when I really kept my blood sugar super stable, postprandial under 110, like super flat, nice. Like what we want, like no big hike. my headaches went away completely. So, and obviously I also work in stress reduction as a vision improvement teacher. I do myofascial release. I work with the body. So,
Wonderful.
so
Yeah.
that was for me the biggest needle mover, where I used to have like Excedrin or ibuprofen in my purse, or peppermint oil, right? That sometimes help.
Mhm.
So, okay. So that's interesting. Hormones. What else? So those are the biggies. Is there anything else that you have found, like maybe in connection to vision, that you have found? Because I feel like a lot of times glasses certainly strained my eyes.
Yeah.
And I felt, when I was younger, I didn't pay so much attention to that. But now, as I got into vision improvement and did the teacher training, I understood a lot more about the connection to vision and strain and stress. But tell us a little bit more what you have found when it comes to vision and migraines.
Yeah, so there's a couple of things. One's more obvious and one is less obvious. So I'll start with the less obvious one. There's actually been a lot of research in the last 5 years about mitochondrial function and things like chronic migraine, chronic fatigue, fibromyalgia, things like that. And mitochondrial function, if anybody remembers from 8th grade biology, right, they're the powerhouse of the cells. And so they are responsible for essentially giving energy to the cells, every single individual cells, including our muscle cells. And so when we can improve our oxygenation, i.e. breathing really good quality deep breaths, so we're increasing our oxygen levels and we're working on mitochondrial function, we tend to start seeing the skeletal muscles being able to relax more. So that's where a lot of that chronic tension comes from, as well as some other things. But when we start working on that, that can actually help to relax everything, including the muscles around the eyes, that will help to not have so much tension and strain and then eye fatigue that happens. So that can be one kind of less direct route that it affects, vision affects migraines. But the other thing is eye misalignment. So I learned about that through my own eye doctor. And when she found out that I specialize in migraines, she started talking to me about this eye misalignment thing where people will focus either in front of a computer or behind the computer or a book or whatever. And that's obviously not in focus. So then their eyes have to really strain to bring it into focus, to shift that focus. And that will cause the vision fatigue, the eye fatigue, and cause some of the migraines that happen because it will trigger the trigeminal nerve, which is very implicated in migraines, as well as vision. And so I started kind of digging into that and finding that there's actually a high percentage of our clients who have undiagnosed eye misalignment. It's not commonly screened for. So we start having all of our clients screen for it, and it can be corrected by prism glasses and some other things. And I'm sure you've got some wonderful exercises to work on for that. But that's actually made a big difference in a lot of our clients who are triggered by, working, like reading a book or doing a lot of computer work will trigger somebody. Those are kind of red flags that we need to get you screened for eye misalignment.
So I just want to clarify eye misalignment. We had an episode recently, and I actually had what's called strabismus, or some people call it squint. But I still have I just saw my ophthalmologist today, microstrabismus, which doesn't affect my vision anymore, but my right eye still goes in a little bit, it was called a convergent squint. So that, when you say prisms, because I did have those glasses as a kid, right, where the eyes are basically like, even if the eye goes to the nose, you still see the feed from the eyes correctly, right?
Right.
So it's that, but there's also, you also talked about people basically focusing in front of something or focusing behind it. So there's over focusing, and then which is usually more myopic. The nearsighted people tend to maybe even over, converge where they look too close, versus a farsighted person, that was my background. We have a problem converging the eyes too close, and then that's called convergence insufficiency. So when you talk about eye misalignment, are you talking about, what we refer to as strabismus or squint, where the eye is like wall-eyed or cross-eyed or something like that, or one eye is higher than the other? Or are you talking also about not actually being able to focus at the right distance?
So I'm more talking about that, not being able to focus at the right distance. However, a lot of people that have that problem also have some sort of physical misalignment that maybe was not obvious enough. But I've heard that, you know, oh, well, they found that actually my eye is like, it's up a little bit, right? And so it's just very slight, but it was enough to cause them tension in the eye muscles that would then trigger things for them when they were
That makes total sense. That makes total sense. And I sometimes see prism, like very mild prism corrections in clients I work with, and they're more done for ease. Like you said, it's usually for farsighted people, like, you know, like they have presbyopia and reading is more challenging. And the prisms are not really there because they have misaligned eyes, like, you know, in terms of strabismus or the eyes,
right.
But they are more to help with the convergence up close. And I usually take them out of the prism so that we actually, you know, I don't like to call it eye exercise, but we train the visual system to actually not need that support. But anyway, so that's interesting that there's a connection to, which is basically a strain, right? We would call that a strain if you're not able to focus. Yeah, that makes total sense.
And even a non-migraineur who spends too much time on the computer that has this problem is going to get a headache from working on the computer too long. Like, we're not meant to sit and stare at a computer for 8 hours a day, but that's kind of what most of us do now. So, you know, if at the end of that day you're finding your eyes are really fatigued or you get a headache and it's annoying, but it's not huge, like there's probably something there to talk to your eye doctor about, to at least get checked to make sure, you know, maybe you need more frequent breaks, or you need to find ways to not have to do that so constantly, not necessarily needing those glasses, but being able to make those habit changes through your day to help give your eye the break that it needs.
I think that's such a great point. And also, like you said, a lot of times it's not diagnosed. Like, you know, you might get just a prescription with stronger plus or minus lens, depending on what your vision problem is, or astigmatism correction, but you're not actually, they don't really realize that you have those challenges with the actual focusing, which is always related. The eye misalignment is obviously related to the eyes together. And a lot of times in the eye exam, you know, we look with both eyes, but they also do a lot of testing, this eye and this eye. And then you have no clue what the eyes are doing together as a team. So okay, that.
Not to interrupt you, Claudia, but I think it's important that not every doctor knows how to do it, nor do they have the technology to do it. So you actually, if someone's interested in that, they'd have to go online and look for someone who actually does that testing. A great website to be able to look up who is capable is neurolens.com. They're the people who make the eyeglasses, but you can actually look up their database of people who have the ability to do that. So that might be a helpful resource.
That is a great resource, neurolens.com. Awesome. Thank you so much. We will definitely post that in the show notes. So that's a good place to look for, especially if you notice that your headaches come on when you've been, you know, doing any kind of computer or reading or you know,
sewing,
right? Where you notice, like, this was something that I didn't do in the past. Like sometimes I had, you know, other people tell me, oh, do you notice every time you do this, then that, you know, you get whatever. And a lot of times we might not pay attention. So I think this is very valuable, what you said. So that could be one reason. But you also talked about mitochondria, and you talked about other, you know, issues related to maybe gut health or nutrition. So what are other things that people could do that struggle? You talked about blood sugar. What are other things that people could do to kind of, you know, improve, you know, or get rid of those headaches?
Yeah. So those three things are kind of foundational. The mitochondrial support is a foundational thing. Another problem that we run into very, very commonly, in fact, there was a study that was done not too long ago, well, probably 10 years by now, but anyway, that showed that people with chronic migraine, with diagnosed chronic migraine, they were 93, 94%, some mid 90% had a deficiency in their major antioxidants, which help us to decrease inflammation, helps us to detoxify and get kind of the junk out of our body. And 94% of chronic migraineurs had deficiencies in their ability to do that. So there's a huge piece of people with chronic migraines that are not able to properly detoxify. And so helping to support those pathways, you know, liver, kidney function, helping people to, you know, sometimes there's a genetic component where their body can't make it enough to be able to handle the toxic world that we live in. And so these are, you know, the people that walk down the scents and the scents that really trigger them within seconds. I usually think, all right, you're probably having a detox, like there's an inflammatory piece that's there and your body's not able to handle the toxins that are coming in the form of fragrances. And so, we really want to make sure that we're helping to support that. So that's a big one. Storms are a huge trigger for people, but what people don't know is that while you can't control the weather, you can control the changes that happen in your body in relation to the weather. So when we have stormy weather come in, it actually causes our serotonin levels to drop. That's why cloudy, stormy, rainy, dreary kind of days make everybody kind of feel blah. You're pointing to somebody.
Right, but yeah, I'm in
Yeah.
Germany. It's been 3 weeks of gray skies, rain, and no sunshine.
Yeah. And people start getting depressed and cranky. And because when we have those pressure systems, those low pressure systems come in, our serotonin drops. And so then the serotonin is our like happy, feel good neurotransmitter, keeps us kind of even keel, helps us to sleep. And so then when it starts to drop, then we don't feel as good. But from a migraineur, that's a huge trigger. Those drops in serotonin is a huge trigger for people. And so whenever a storm comes rolling in, they're feeling like, I can't do anything about it. This sucks. Like, this is my life. Well, it's not, because we can actually support those serotonin pathways with things like 5-HTP, tryptophan, melatonin. And our clients actually can now manage storm-induced migraines by just a couple over-the-counter supplements through the day as they're, dealing with this weather. So working on and kind of knowing some of those tricks can be really, really helpful in not having to take their abortive medication, which is another big trigger. When people have to use their medication 3, 4, 5 times a week, then we start getting into that rebound cycle where then you're having ups and downs in your neurotransmitters and your, blood vessels that constrict and release. And then you're constantly, chasing the symptom. And that can be another big problem is the medication overuse too.
Well, thank you so much. But we do want to make sure that we don't give medical advice. And even when it comes to melatonin and 5-HTP, you do want to make sure that you work with a practitioner, that you take the right amounts. You talked about genetics in terms of the detox pathways. And actually our topic in the Clear Vision Club this month is detoxification. This is such a fascinating topic. Can you, maybe some of the listeners have done like 23andMe or some other kind of basic genetic testing. Are there specific genes that you can point to right now that, maybe somebody wants to look up if they have homozygous, which is the 2 greens, right? Basically the hetero is a yellow, and then the wild one is the green. Sorry. Homozygous is the 2 bad ones.
Right? Homozygous means you have 2 of the same gene. So it could be good. You could be homozygous in a good way, but you can also be homozygous in a bad way. And so when we're looking at the red genes, we don't want to be homozygous. We don't want 2 reds. Right. That's bad homozygous. So there are links to MTHFR which is responsible for basically all the cellular processes that occur. So there's MTHFR, the COMT gene, and MAO, the monoamine oxidase gene, are 3 that have definitely been correlated with increased migraine frequency and intensity. In my experience, there's also a relationship with DAO, which is it's the diamine oxidase, which is responsible for breaking down histamine. So people with MCAS, high histamine levels, things like that, tend to have issues with their DAO gene. And then I also see a lot with the glutathione piece. So GST, GPX are 2 genes that are highly involved in the detox pathways. And so I tend to see those not functioning well. The PEMT gene is another one involved with detoxing. And so those are also not maybe quite as high, but I do find those mutations quite frequently in people that I work with, which is going to mean that their ability to detoxify is hampered. And that's one of the reasons I think why we see that frequently in the migraine population. We just can't detox as well as people without migraines.
That's interesting. I don't have my chart in front of me, but I remember some of those names in there. And I think sometimes, this is not an episode about detox per se, but I think it's important to know that your genetic background and what you're exposed to, because sometimes you hear these things. we have kidneys, we have liver, we don't need to detox, but we are, first of all, we're not made to the, to withstand the 80,000 chemicals that we have these days.
Yeah, it's
And
crazy.
also, like you said, if you're compromised in the genetic makeup, then you have to be really careful with these things. So it's like, I love that approach that we're not all the same, and it's not like just because you need to do this, I might not need to do that, or vice versa.
Right.
And I have high blood pressure in my genetic makeup, and my mom always says there's nothing you can do, and I said there is something I can do, but I have to be very. She's like, you're so, family, right? When you over the holidays, why can't you tolerate these things? I'm like, I can, but it raises my, it's not good for me, and I don't want to
Yeah.
eat this. It's not like I burst into flames, but
No
anyway.
spontaneous combustion, but a headache.
But those discussions where you're like, I don't know what's wrong with you, why can't you have all these things? And I'm like, I just don't want to, because they have side effects on me. So
Yeah,
yeah.
that's right. And I think it's important to note too, like when people hear, oh, well, it's my family, like it's my genetics, there's nothing I can do about it. And like you mentioned, there absolutely is. So while we can't change our genes themselves, we can actually influence how they function. So we can make a heterozygous, they're called SNPs. I don't like the word mutation, but the heterozygous SNPs that make it less functional, we can actually do things to make the genes that you have work optimally, which can improve your situation significantly. So there is a lot that people can do to help support a healthy gene function, even if they are born with the bummer genes.
Awesome. I just saw a question, two things on YouTube, and I know you also wanted to talk a little bit about posture before we get into the spirit piece, which I think is really important. So Nancy said on YouTube that a red left or right a head tilt, and I also know like a rotation, right? That can already create a misalignment in the eyes, which
Yes.
something I see too, where people like rotate their head, or they always do this, or they always do this, and there's a connection to astigmatism too. But I'm sure there is a connection to that migraine level as well, right? When you kind of don't,
Absolutely.
yeah, that makes so
Yeah,
much
yeah,
sense.
that's actually something that I meant to mention. So thank you for bringing that up. When we have those eye misalignments, we will unconsciously change our body posture. So you might find that, you rotate forward a little bit and your head is down, and it misaligns your spine just enough to create tension in your back and your neck and your shoulders that then will trigger migraines as well. So yes, it's not just the eyes themselves. It's actually the minute adjustments that we make to assist our eyes in seeing the picture clearly that then can lead to some structural issues that are problematic from a migraine standpoint as well.
Thank you, Nancy, on YouTube for bringing that up. But yeah,
Yes, good
sometimes,
question, Nancy.
somebody might have better hearing on one ear, and then they might just, or the one eye doesn't see so well. And so there's definitely a connection. There is a question that before we get into the last piece, I do want you to see if you have an answer to that. So I don't know how to say your name on YouTube. Can you tell me a little bit about retinal migraines or optical migraines? So that's a question that I think a lot of people have.
Yeah, so there are a lot of people who don't have the standard migraine of severe pain and things, but they have, vision or the vestibular issues. They're all kind of treated the same, right? The same issues stem for kind of everybody who has migraine as far as mitochondrial function. Like there's not really differences in detoxification abilities and all that. It's just a different presentation of symptoms for different people. What we do tend to see, though, that's different is the neurotransmitters that are involved with the different types of migraines. So I mentioned serotonin is a very common one for chronic migraines. When we're looking at vestibular issues, we tend to see more like glutamate and acetylcholine as being a major issue. And I actually haven't really specifically looked at neurotransmitters for the retinal or the ocular migraines. So I can't actually answer that piece, what neurotransmitters involved there, because I tend to, it's probably very similar to the typical migraine picture, because I treat ocular migraines the same way I treat a quote unquote regular migraine. The ones that we do something different, a little different with would be the vestibular because of those neurotransmitters that are different.
Well, I guess it's really important to see someone like you, like a naturopathic doctor, somebody who like you who is specializing in this to really look at all the nuances and,
It can be very complicated.
yeah,
Yeah.
sounds like it. Everything you mentioned, wow, this is like Sherlock Holmes. To figure out, like, looking at really the genetics and probably labs and all these different levels of, what could be the main reason, and then second and the third reason. So I do want to bridge the gap a little bit here, because when we first met, you told me about a field that I had never heard anything about. And so, in the headline of this episode, we talk about spirit. And you mentioned to me that you are, that neurotheology. I'm like, what is neurotheology? So tell us a little bit about, I know you just implemented that into your programs, right? So you added that layer into your treatment and to your programs. So tell us a little bit about that. What does that mean, and why are you doing that?
So this is fairly relatively new to me in the last few years as well. I started having, because you hear all the time meditation is so great for you and mindfulness, and I wanted to know, how is that actually affecting our biochemistry, our neurochemistry, and how can I utilize that to improve my clients' outcomes? And so I started digging into it and started running across all kinds of, when we talk about meditation, nobody really thinks about meditation from like it's more of a spiritual as opposed to a religious practice, right?
Mm-hmm.
So then I started kind of digging a little bit into religion versus spiritual health versus, none of the above. And there's actually differences in outcomes when we focus on there's a hierarchy, right? So meditation, secular meditation, meaning, we focus on a mantra like, the air feels good, or the sun is bright, or, whatever it is that people are focusing on, that doesn't have to do with a religion or God or anything like that. That is considered secular. Secular meditation is better than no meditation. Spiritual meditation, where we're focusing on something outside of ourselves, but not really from a really religious standpoint, right? It might be your higher self or the universe or whatever it is. A spiritual meditation is better than secular meditation. And then when there was a religious piece where they were actually communicating or focusing on a relationship with God, that was the most effective of all of them. And so it started to fascinate me that there were actually differences in the types of meditation, and they also threw relaxation practices in, right? So like just breathing into your muscles and helping to relax them. That was below secular meditation, but above nothing. So there was this hierarchy that I was seeing emerging in the research. And so that led me down the path of wanting to explore, like, what does faith in our healing journey really mean? What does, and that's when I stumbled across neurotheology. There's actually an entire realm of science devoted to the effects of religion on our physical bodies. And so then, all bets were off, and I started doing all kinds of digging. And I mean, there's connections to vision, there's connections to stress management, there's connections to cancer, blood pressure, everything. And it was just like, wow, why is this not something that the medical field is really doing something about? Because every single article that I looked at suggested that this is such a huge piece of us as human beings and our health that we should, as doctors, be incorporating questions on a patient's spiritual health to understand how big of a piece it is for them, what practices they're doing, and how you can utilize that to optimize treatment outcomes. And yet nobody does it. I've been a Christian my whole life, and I've never even thought about asking somebody about their beliefs, because that's kind of taboo. Like, you don't talk about that in a doctor's visit. And so then I started getting really passionate about, all right, well, let's see how this outcome will change if we start incorporating these ideas into what we're doing. And so that was one of the big underlying reasons why we just totally redid our program, was to incorporate some of this research and start seeing, all right, what are we seeing in as far as improvement in pain levels, improvement in just overall outcome, anxiety, depression, that's super prevalent in a chronic migraine population. How can we see some of these things changing as we incorporate some of these practices into what we've already been doing? And we've already been getting really good results because we're so individualized, but 91% reduction isn't good enough. Like, I want 100. So can we bridge that extra 9% gap by incorporating some of these other, practices and things. So that's kind of how I ran across it. And the research is just amazing. Yeah.
So I'm curious, I know you just started to incorporate it, right? You just launched into your programs. So first of all, I'm interested in some of the studies, if you have any examples. And also I'm curious, like you mentioned Christianity, right? But there's like, Muslim, and then there is, Judaism, and then there's Hinduism. So when they looked at in these studies, did it matter like kind of what gods, you know what I mean? Yeah, okay. So basically,
right, yes.
Okay, got it.
So
okay.
it's still a science. It's still science, right? And so they didn't. I've run across a couple where they've tried to look at Christian versus Hindu versus Islam. Buddhism is another one that they study a lot. And I haven't really seen a whole lot of research breaking those pieces apart.
Okay.
But what they do is right. So it's not necessarily the religion that they're finding. It's just that you have a relationship with God, and that you're doing some sort of active practice to build that relationship, right? That's kind of the idea of religion. So I have a ton of studies because I figured you'd probably want to hear some of them. So I specifically
tell us some highlights.
Yeah. So across the board, every single study that I looked at, there is some level, if they were measuring cortisol levels, there's 50% reduction in cortisol levels, that even when these people did their spiritual meditations, and this was spiritual, this wasn't even a religious practice, this was a spiritual meditation, reduced their cortisol, and this was done in police officers, reduced their cortisol levels by 50%. They did it for 8 weeks, and then they still saw an additional 3-month benefit even after they stopped doing it for 3 months after the end of the study. So this had significant impact in cortisol levels in police officers, which have very high cortisol levels.
Quick question, how long did they do the spiritual practice every day?
For 8 weeks.
But how long every day? Like 5 minutes, 10 minutes?
Generally it's anywhere between 20 and 30. I don't remember for that specific practice, but generally the studies are showing between 20 and 30 minutes of a religious meditation, prayer. Yoga is used sometimes if it's done in a prayer-like manner. So any of those kinds of, but you definitely have to be in some sort of like a intentional relational practice with a being outside of yourself, right? That's what they're talking about from a spiritual standpoint. So spiritual meditations had, I just lost it. Spiritual meditations group had a greater decrease in anxiety, more positive mood, better spiritual health, and more spiritual experiences than secular meditation or relaxation techniques. This one I thought was interesting. 83 meditation naive people with chronic migraine, so they've never meditated before, were broken into spiritual meditation, internally focused secular meditation, so like feeling within your body, externally focused secular meditation, where they're focusing on something outside of themselves, and then just muscle relaxation. And compared to the other 3 groups, the people with spiritual meditation had greater decreases in the frequency of migraine headaches, anxiety, and greater increases in pain tolerance, headache-related self-efficacy. So basically that means that they were able to do more even though they had some headache symptoms, and their overall well-being. So, and I mean, I could list 100 more studies like this. Coming into some of the vision things, every study that I found relating to vision improvement and spiritual practices came back to the idea behind 2 things. One was cortisol. So as we reduce our cortisol levels, our muscles relax, and that translates into, improved vision. And then also the other thing was that over time, as you establish this habit, you improve your levels of oxygenation. So just part of the physiologic changes that happen as we meditate is we start to breathe more deeply and more effectively. Our blood oxygen levels go up. And so as we get more oxygen, we start seeing muscle relaxation, improved, immune system function, improved healing times, all of that. So that's another way that I commonly found popping into, how vision can be improved with meditation too. So some really interesting, it's still fairly new. I think it's only been around for about 20 years that they've been really studying this intensively. But, and so we're still learning a lot about how religion is affecting the human body. But there's still so much research out there that absolutely something that we should be thinking about and starting to bring up with our doctors to say, hey, this is an important piece of my life. Like, I think we should talk about it and incorporate this into my health plan.
I think it's so tricky because it's just, because there's such a divided world, and just people, and then different religions. And so if we like, I think this is such a wonderful idea. If we can figure out a way where it doesn't end up being like,
divisive.
Yeah. So I think it's like, say, with the political system, right? Where people kind of get really, anyway, we don't want to go into that whole story, but I think it's wonderful. And I've heard of a story, I cannot remember for my life of it, where people were praying for some people and they thought they were in the hospital, but these people like were in the hospital 20 years ago.
Yeah.
And they still had like, where you like, how is this even? It's like, when you think about the universe, how can we even imagine, the planets, like how can we even comprehend, like, I was like,
I know.
how does that work? Have you heard of that story?
I have heard of that story. I have. I haven't found it myself, so I don't know if that's just, kind of internet rumor.
Maybe it wasn't a Joe Dispenza book, but I cannot remember. I think there was a link to it. But anyway, I was like,
Claudia, I think that's where I heard about it too, was through Joe Dispenza somewhere.
Well, let's find out if that's true. But anyway, it was like amazing where they were praying and they thought that person, they were praying for somebody who's in the hospital right now. And these people were in the hospital, like 20 years ago, and they had better health outcomes afterwards than people that were not prayed for, which I don't know if that, so we don't know if that's true. Actually, I just popped into my head.
I know. But yeah, definitely it's something that I think is tricky to navigate. But as doctors, I think it's our responsibility that anything that we have research behind that is going to support our clients, like it's our obligation to make sure that we're supporting them. That doesn't mean that we push our agenda onto our patients. We have to be open to where they're at and what they're doing and see how we can work their beliefs into, their healthcare plan. But it's definitely something that I think needs to be talked about more. And I think that it's something that we need to take the taboo off of. And, whenever I have people, talking about the idea behind it, it's like, you kind of see the barriers go up because it can be so divisive. But yeah, I think that's part of our job as doctors.
Well, I'm so glad that you were here and that you enlightened us with this topic because doctors mostly just look at physical stuff, even emotion. When I look at vision, and we had a discussion before we went live. When you get your glasses, what happened, and there is always some emotional, like adverse childhood event or trauma or something that is upsetting to the nervous system. And when you go to the doctor, just have you look at an eye chart, right? And you're like, oh, you can't read the letters. So it's crazy that we still there's a level of, physical, mental, emotional, and spiritual, right? That really all these levels. So this was amazing. So first of all, I don't see any more questions on YouTube, but where can people find you? Like, how can somebody work with you or find you or follow you? Let us know. Like, we have everything listed under the video too, but just in case, like, what are the best ways to connect with you?
Sure. Well, you can find us at our website. It's psalmmedical.com. So PSALM medical.com. You can find us on YouTube as well is, oh my goodness, I just blanked on my YouTube channel. Migraine Mastery and Migraine Free Life. There you go. Where we kind of talk about some of all of the things that we've touched briefly on today. So we've got a lot of videos and stuff there. And then we're also on Facebook at Psalm Medical and End My Migraine Support Group.
Great. And we have all these resources listed. And I think you also have some kind of free, some guide that people can download. Is that correct? Or am I making something up?
No, I do. I have a, I call it my 5 things. So this is kind of my mini ebook that has the first 5 things that every person struggling with chronic migraines needs to know about, including, labs that they should be looking at and the ranges that they should be in, not just you're within normal range that you always hear, right? You're fine. Your labs are fine. Well, there's different lab ranges for migraineurs. So I have the kind of those top 5 things laid out for people. So hopefully it's helpful for someone.
Right, I will put that in the YouTube chat right now, but it's also under the video, so everybody watching. Well, this was really interesting. Thank you so much. And we will have a little private after party at with the Clear Vision Club peeps here on Zoom. And so everybody on YouTube watching, goodbye and have a great first week of January. Any last words you want to add, Tanya?
I just want to say thank you for having me. It's been, I love talking about migraines and spiritual health. So
Wonderful.